Australians are lucky to have a diverse and affordable healthcare system that ranks amongst the best in the world, as reflected in the high life expectancy and low infant mortality rate at the present time. However, there still remain areas where it could be improved. In your lifetime, it is more likely than not that you will have interacted with the healthcare system in some way or another. This may have been positive or negative, and by looking closely at different parts of the health system, this video will hopefully shed some light on why this was and give you a better understanding of some of the benefits and challenges of the Australian healthcare system. At the forefront of our health system is the health workforce. Health professionals range in their skills and qualifications, with the ability to diagnose and treat physical and mental illnesses and conditions, or recommend, administer, dispense and develop medications and treatment to promote or restore good health. The needs of an ageing population and the growing burden of chronic illness puts a strain on the existing health system, calling for health workforce reform by means of improved capacity, productivity and distribution. This is beneficial in some respects for the health workforce, as it increases the demand of health professionals and also the total government expenditure on health, which has been steadily rising since the 1980s. There is a high percentage of overseas trained doctors who also work in the Australian healthcare industry, ensuring that it is multicultural and well represented. This is a testament to the good working conditions present in Australia when compared to other countries' health systems. Whilst this is very beneficial in terms of the diversity of care available to the population, it can often prove to be limiting on the distribution of services available to different areas of Australia, considering many foreign health workers prefer to work in more urbanised metropolitan areas. This then leaves significant shortages in outer metropolitan, rural and remote regions, especially in Indigenous communities and in particular areas of care such as mental health, aged care and disability care. The considerable shortage of health professionals in rural health has caused significant strain on the rural health system. Rurality contributes to many health inequities in the community, such as isolation and limited access, especially for those in vulnerable groups, for example children and the ageing population, who cannot actually drive themselves to see a doctor. These inequities can be improved through the provision of more incentives for health professionals. Indeed, many health professionals work outside of their training as well as overtime. Also, increasing the awareness of the issue, as many people simply don't know about the shortage, and the need for rural health workers hasn't been promoted enough to university students studying to be health professionals. However, let's think of it this way. Positives of working within a rural health system environment include many opportunities for promotions and personal control, as well as chances for starting up your own clinical practice, opportunities for personal connection with a role model or mentor, as well as flexibility in job field. Best of all, it is truly a rewarding experience because it's such a tight-knit community, and as a health professional, you can really see the impact you have. Public hospitals are large organisations that form a major part of the healthcare system. You could say that public hospitals are pretty important, providing a continuum of care, educating health professionals, contributing to health research, the economy, and to community well-being by providing employment. Public hospitals are also largely responsible for providing regional healthcare, with only 21% of hospitals in main cities and remote areas and 58% in regional areas. However, their role continues to evolve as medical practice and technology advances. Due to their high demand, public hospitals face many challenges, such as ensuring safe and quality care, preventing bed block, and increasing cost pressure. Public hospital admissions are also covered by the government health coverage Medicare. Not just in Australia, but in most developing countries, public hospitals have become one of the most costly aspects of healthcare delivery. Medicare is the healthcare system governed by the Australian Commonwealth, providing primary healthcare to millions of Australians every day, with the intention of creating equal access to healthcare for all. It is the basic health cover, including subsidised costs for GP visits through bulk billing and access to low-cost medicines through the PBS. Medicare is organised into two parts. One part deals with funding public hospitals, which is handled by state territory governments. The other part deals with direct payments to primary care services, for example GPs and physios, and is handled directly by the Commonwealth Government. And so far, Medicare is working. But for how long? With a growing and ageing population, Australians are living for longer with higher life expectancies. This means the quality of healthcare must also rise, but Medicare is already under strain. So, how can we afford all this? The recently proposed mandatory co-payment of $6 under Medicare for bulk billed access to GP services does not answer the question of where will money come from to fund Medicare. Already, Australians pay on average over $1,000 a year on out-of-pocket costs, amongst the highest in the world. Medicare alone will not provide full access to healthcare. It only provides the basics. Private health services aren't covered. So with all that talk of insurance, why would you want to pay more when you already get hospital cover free? Well, there's a few reasons. With private health insurance, you also get physio, dental, elective surgery and other benefits. If you don't have private health insurance and you need something like dental, your costs will go up. Private health also gives you more options if you are sick. At the moment in Australia, private health services account for 81% of mental health treatments, 60% of all cancer therapy, and 4 out of 10 people admitted to hospital do so through private hospitals. So, is there anything wrong with the private health provision? Well, obviously it is expensive, which means it is not really equitable and fair for the greater population. Basically, access to care is based on the ability to pay rather than the need. Also, some people say it takes the responsibility away from the government for service provision. For example, a large amount of elective surgery is performed in the private sector. Critics argue that the government isn't doing enough to address this issue. But it's up for you to decide. Hopefully you now know a little bit more about the Australian healthcare system. Every healthcare system has things that are good and things that can be worked on. Australians are lucky to have a healthcare system that's universal, provides a high standard of care, and a wide range of options. However, more needs to be done to improve the capacity of the health workforce, the provision of rural health, and the increasing burden on the public hospital.